So I'm going to present some work we've been doing with the WIN Consortium on the insecticide resistance management strategies applicable to mosquito vectors of arboviruses. So just as an introduction, so you know that resistance is a heritable and selectable trait. So at the beginning in a population, you have rare resistance, but if you apply an insecticide and then so that would select some resistance, and after reproduction and selection of those populations, the insecticide resistance will increase. The idea of insecticide resistance management is then to prevent or slow down the insecticide resistance development. Some factors are influencing this development, which are the insect biology. If an insect is developing faster than another one, then the development of resistance may go faster. Mosquitoes have short life cycle compared to other pests, for example. The genetics of the resistance can influence the rapidity of development. So if the resistance, the alleles is dominant or recessive, you also have all the genetic costs that Milan talked about earlier. If the resistance give a cost at the reproduction, then that will slow down the resistant development. And finally, the insecticide pressure. If the insecticide is applied at a high frequency, or in a lower frequency, if there is other insecticide pressure, such agriculture, that may increase the development of insecticide resistance in populations. And mainly we can impact only on this last one, because the other one we cannot work on that one. So to prevent or slow down insecticide resistance development, there is some strategy. So first, this resistance management must be integrated from the beginning of any vector control program, which means monitoring the insecticide resistance, control efficacy from the very beginning, and then use methods which can limit the resistance development, such alternating or rotating or mixing insecticide with different mode of actions, because individuals which be pressure with two different insecticides with different mode of action won't be able to develop a very efficient resistance to the two of them. And then integrating more all environmental management and non-chemical control. So this is a decisional tree when you do monitoring of resistance or vector control efficacy. Okay. So first, monitoring is doing bioassays. Where is the point? Okay, it's okay. So first is to integrate the resistance monitoring, doing bioassays, which can be done in vector control agencies, by vector control agencies in different localities and at least once a year. Then a researcher must characterize insecticide resistance mechanism to do a follow-up and early detect resistance. But these two actions are important only if you have a plan after that. What do you do if you detect resistance? So you need so once you've done your bioassays and characterize your resistance or detect mechanism of resistance, then you know you need to define risk level and define a strategy. Okay. So this is just an example how we can define risk level. So you have level 0, which is susceptible population, no adaptative measure. So you can measure either threshold on larval bioassays or an adult bioassays, and you do a mechanism characterization if you know those mechanisms for the insecticide you're looking at. Level 1, the same thing. You could not see any resistance on your test, but they start to detect resistance alleles in your population. And it's go on like this with a level 2 and level 3, where you detect resistance and the mechanism, and then you adapt what you have to do in those levels. And it's really important, because doing bioassays or looking at mechanism of resistance really needs a plan after to contain the resistance development. So I think I won't just go fast on that one. This is a different test to detect resistance mechanism, but my colleagues already talk about it a lot. And then the second process will be to look at what's going on in the field, the efficacy of the vector control done by vector control agency. If they observed a failure in the control, they need first to check on the treatments. If there is any failure due to the operation, the applications, or other cause, temperature or weather, and if all of this is okay, then they can go for bioassay in the field. And then if it's not done before, maybe check on insecticide resistance, as I presented before. So now a couple of examples of what has been done in the insecticide resistance management in public health. So this is an example which has been conducted against onchocercosis, the river blindness disease, sorry. So this started in 1975 when they decided to eliminate the transmission of the onchocercosis by stimulum species in West Africa. So this is started in 1975 with the spraying of Temephos in the river. So this is where the Simulium breed and the larvae developed. And in 1980, they observed resistance. So they started to do a rotation of insecticide with different mode of action in the rivers. And it lasts over 20 years. And for 20 years, they observe a reversion of resistance, and they maintain the susceptibility of the simuli in West Africa. Another example, and it was just a trial in Mexico in the 1990, I think, against Anopheles albimanus. They've been tested different IRS spraying in 8 groups of 3 villages, DDT only, pyrethroids, rotation of different insecticides, organophosphate, pyrethroid, and carbamates, and then a mosaic. So different houses were treated into the villages. So what do they observe? That in the pyrethroid only, the resistance developed into 4 years, but rotation and mosaic maintain resistance to pyrethroid and OPs at low level. But rotation was easiest to implement than mosaic, which I can understand. But it was only a trial. It never be taken to a larger scale. And the last example is actually unpublished data from some of my colleagues in New Caledonia, Institut Pasteur in New Caledonia. Actually, they've been doing spraying against Aedes aegypti, spatial spraying with deltamethrin and malathion since 2003. And every time they observed the deltamethrin resistance coming, they were switching with malathion, and they were doing surveillance, and then they alternate this, and they maintain a low level of resistance in their population in New Caledonia. But since 2015, they cannot use malathion anymore, so they are expecting an increase in resistance to deltamethrin. So now we know there is few programs in place to really manage this resistance. And I think a lot of those points have been discussed today. Resistance monitoring is mainly underperformed, and even sometimes if it's done, there is no action after that. The field evaluation is even less performed, and the impact of resistance on the efficacy is not always done either. We need more reliable and easy tools, like we need to review the diagnostic dose, but we already talked about it today. More markers. Trying to develop other alternative methods and validate them and prove it works at large scale, because sometimes operators are not fully convinced, so they don't use it. And then there is this regulation, and I'm going to talk more about Europe because French Guiana is a French country, but we can just use deltamethrin and pyrethroids in French Guiana. So now that we've been using deltamethrin for a long time, we had a lot of epidemics, dengue, then chikungunya, now Zika, and insecticide resistance in Aedes aegypti is just exploding. And it's Jean-Philippe who did some work on our population, and the resistance ratio is over 700. And we have no other alternative for now. So how to address the gap? First, provide tools. I think we had a good demonstration today. Updating the diagnostic dose, validating markers to early detection, developing rapid, cheap, and simple detection, searching for and validating molecules, new molecules and methods, providing guidance for the people in the field. I show you the decisional tree, but they need to know what to do and have standardized procedure. Give support. Sometimes people have questions, they need some expertise, and sometimes they cannot perform their own essays because there are not too many people in their team in the field. So may need some reference laboratories who can help even in producing papers, for example, implementing papers. And some of them need to be trained because they could do it, but they have no skills for it. Then raise awareness, first in the communities, because there is some source reduction which could be done by the people, but they don't know, or they don't know what is a mosquito. They don't know that it's really important to reduce the source of mosquitoes. To the operators about insecticide resistance. And then politics, industry, and also to fund funding resources. And then finally, increase interaction, because we're doing research, trying to develop new methods, but it's not going to the operational because they really need strong evidence of it works, because they need to invest money in these new methods and change what they do daily. And then more connection with the agriculture sectors in the area where you have agriculture to coordinate to decrease the insecticide pressure. And all of the things that I've just listed was actually a bit in the 5 pillars of the global plan for insecticide resistance management for malaria vectors. So this can be a good basis for discussion if we want to develop such document and such guidance for the future. And so these 5 pillars were actually declined, so you may not be able to read it, but declined in activity with a timeline of action to complete. So it might be something we could discuss on Wednesday. And I want to thank the networks, the colleagues, and all the support for this meeting. Thank you very much.